Good morning, and welcome to the American Kidney Fund's 7th Annual Kidney Action Week. I'm LaVarn Burton, President and CEO of the American Kidney Fund. And on behalf of all of us at AKF, I want to wish you a happy Kidney Month. We are so glad you're here. By signing up for Kidney Action Week, you've taken an important step. Whether you're newly diagnosed or have been managing kidney disease for a while, or you're a caregiver or loved one, Kidney Action Week provides a forum in which you'll feel a sense of community and come away truly equipped for every stage of the kidney journey. And if you're a member of the Kidney Care team, thank you for being here to listen and learn alongside those living with kidney disease. We're honored to bring patients, caregivers, and health professionals together this week for a series of virtual sessions that we've put together with the core purpose of ensuring you feel supported and empowered to take charge of your kidney health. In fact, that's the theme for this week, supporting you every step of the way, from kidney diagnosis to transplant. You'll see this theme reflected each day. Today, we'll start with the basics, and the rest of the week, we'll discuss managing kidney disease, considering treatment options for kidney failure, and what's new in kidney care. For each of these sessions, you'll hear from those who have walked this path and can bring you hope. People like Craig Merritt, whose kidney transplant transformed both his life and purpose. Teresa Caldron, whose advocacy work is driven by her personal experiences as a registered nurse who faced acute kidney failure. And Emmett Henderson, who has faced every health challenge with courage and resiliency and promotes a positive mindset. You'll also hear from top experts in the field, nephrologists, dietitians, social workers, and more, who dedicate themselves to making life better for all those in the kidney community. I encourage you to take the opportunity to actively participate in our Connect with the Kidney Community breakout sessions later today, when you'll have a chance to connect live with others like you in a small group setting, as well as the live Q&A sessions happening each day. You'll have a chance to ask questions of genetic counselors, renal dietitians, transplant professionals, and AKF's Chief Medical Officer, Dr. Pranav Garamella. Highlights in the week include sessions such as exploring medicines for people with kidney disease and diabetes, how to get started, your path to home dialysis, and technology in kidney care, the role of telemedicine, mobile apps, and artificial intelligence in managing kidney disease. On Thursday, please be sure to join us for our policy briefing, during which our expert panel will discuss opportunities to accelerate progress in policies, as well as strategies to promote and incentivize innovation in kidney disease care. That's just a sampling of what's in store for this week. And I want to thank all of our sponsors who helped make this event possible. Today, please tune in for a Kidney Disease 101 session, a Q&A with genetic counselors, and a session on understanding the causes of kidney disease, as well as steps to take after diagnosis. Invite others, your colleagues, patients, caregivers, and anyone you know who may have an interest in kidney care to join some of the sessions this week. I hope you have a great Kidney Action Week. I'm honored to be on this path with you. Thank you for your time, your questions, and your commitment to action. Now let's get started.
Hello, everyone, and welcome to today's session, Kidney Disease 101, everything you need to know about kidney disease. I'm your moderator for today, Craig Merritt, kidney health coach with AKF and also the host of the Kidney Corner podcast on YouTube at Get in Position 21. I'm so excited that you guys decided to join us today. And during this session today, we will learn about the basics of kidney disease, including the roles of the kidney, common causes, symptoms, the different stages, and important tests. So, without further ado, I would like to introduce this session's speaker, Dr. Julie Wright Nunez. Hey, Julie, how you doing?
I'm great. Thanks for having me.
Good to see you.
Good to see you too.
Awesome. So we have a great bio, and I'll read just a little bit about Dr. Julie. That's what her patients call her. So Dr. Julie is an associate professor in the Department of Internal Medicine, Division of Nephrology at the University of Michigan. She is a health service researcher with a focus on optimizing patient-provider communication and patient education programs to help patients with kidney disease achieve the best possible outcomes. Dr. Julie is a past member of AKF's Board of Trustees, past chair of the AKF Medical Advisory Committee, vice chair of the Kidney Patient Education and Public Outreach Committee, and chair of the Clinical Scientists in Nephrology program. Wow, that's very, very impressive. And first and foremost, Dr. Julie, welcome back home here at AKF. We're glad to have you. And I know you have a wonderful presentation for us today. And so I'll hand it over to you.
Great. Thank you so much for that lovely introduction, Craig. And I'm so excited to be here. So we'll jump right in. These are my disclosures. And we're going to start by talking a little bit about the kidney basics. So usually people have two kidneys. The kidneys are located in the lower back area of the body. They're about the size of an individual's fist. And they're really remarkable in what they do. They help clear toxins out of the body, but they also do a lot of other things like controlling blood pressure, keeping bone mineral health and our bones healthy, regulating vitamin D, keeping electrolytes balanced in our body, and sometimes are associated with other chronic conditions as well that I'll talk about in just a second. Kind of in the bottom of the slide, there's kind of a cartoon picture of the kidney, just one of them, showing that the blood goes in and it gets filtered, the toxins are removed, and then they're excreted out in the urine. I'd like to talk about two tests to check kidneys. So there's more than one test, there's more than two tests, but I'm going to focus on two in particular. The first one is called eGFR, which stands for estimated glomerular filtration rate. And when I talk to my patients in clinic, I kind of give them an analogy to understand it a little bit with everyday things. So for example, if you have a car, you want that car engine to run at 100%. And what I tell patients in an analogy is that you can look at the eGFR or the filtration rate. You want that to be 100 as well. That tells you that your kidneys are running at 100%. And if it's lower than that number, the eGFR or the kidney filtration is reduced. Again, that's a blood test. There's also another test to check kidneys, something called urine albumin to creatinine ratio. There's a lot of terms, and golly, kidney people love these terms, especially kidney doctors and all kinds of acronyms. It's kind of sounds fancy, but really what it is just a test of your urine. And it's to check something called albumin, which is a type of protein. And if people are leaking out too much of this albumin in their urine, then that's an indication or can be an indication of chronic kidney disease. So together, these two tests help us define if a person has lower filtration or abnormal amounts of protein in their urine called albumin, and that goes into the definition of chronic kidney disease. There are lots of different causes of chronic kidney disease, and later today and throughout Kidney Action Week, we'll learn more about that, so I'm not going to talk about that too much. But here is a slide showing causes of kidney failure, and just to be clear, kidney failure is at the very end stages of chronic kidney disease. But what this slide shows is that the common causes of chronic kidney disease are diabetes and high blood pressure, but then there's a whole bunch, 34% of other causes as well. Now we'll talk about signs and symptoms of chronic kidney disease. Signs are things that we see, either as a patient or as a clinician. And then symptoms are things that a person might feel. So as far as signs, we might see high blood pressure. We will see things that I talked about already with maybe abnormal amounts of protein in the urine or a reduced filtration rate on blood tests. We might see swelling in the legs or other parts of the body, as well as other things. The symptoms, I'm not going to list all of them or read all of them. I listed them here. But if you peruse them, you'll see that a lot of these symptoms are nonspecific. You might feel them with other types of diseases or just illnesses that go away. So the take-home message here is that these symptoms are over time and progressive. And a key thing that I do like to talk about with my patients is sometimes there aren't any symptoms at all. So here is one table that shows the stages of chronic kidney disease by that filtration rate. And what we see is that there are 5 stages, 1 being the most mild and 5 being the most severe. As kidney disease gets more severe, we think about some of those things that the kidneys help manage, like the blood count, stopping us from being anemic, bone health, managing vitamin D levels, and associations with other conditions like cardiovascular disease. Once we get towards stage 4, we'll be talking to patients more about how to prepare for therapies like dialysis or kidney transplant if they progress to stage 5. And then stage 5 is where we, at the later stages, will provide people with these therapies. This is just another way to look at the staging. And it's a very busy table. It came from something called Kidney Disease Improving Global Outcomes Organization and Initiative. It's really here to provide you with another way to look at the stages that include GFR. So if you go down the rows, we see G1 through G5. And this is just, again, referring to the filtration rate. And then we have albumin going across each of the columns, A1 to A3. And this is suggesting more amounts of that albumin in the urine. And what we can see here is that there's provided in each of the boxes kind of frequencies of when clinicians might test for blood and urine testing in patients, depending on the severity of the chronic kidney disease. And from green, it's more mild stages, to getting into red is more advanced. So there are lots of treatments for kidney failure, and kidney disease and kidney failure, and it really depends on the type of chronic kidney disease that you have. But there are mainstays of treatment that I talk about with all patients. One of them is reducing dietary sodium to less than 2,300 milligrams a day, and that can be a hard concept even for a kidney provider. But working with a dietitian may help. So sometimes referrals to dietitians if it's confusing or you need more assist, or working with your clinicians. We also want to make sure that we maintain a healthy weight. If we have diabetes or high blood pressure, that we keep those in goal. That we avoid taking too much of certain medications. So always make sure that your clinician knows the type of medications that you're on and the dosages. The kidneys like water. They like staying hydrated. Usually I'll recommend to my patients to have 1.5 liters or 50 ounces-ish a day. Now that does change a little bit depending on if you have other conditions like a heart condition where the heart might not want a lot of water in the body. But generally those are some recommendations, and staying active and avoiding smoking. Now, there are treatments for kidney failure. So the very end stages where your kidneys just can't keep up with all of the needs of the body. There's different types of dialysis, one called hemodialysis, where the blood's taken out of the body, circulated clean, and put back into the body, and peritoneal dialysis that uses an exchange of fluid within the person's abdomen to take toxins out of the body. There's also, of course, kidney transplantation as well. Just some practical tips. And again, I don't know that I'll read through all of them. I think the most important part is that if you're learning about a new diagnosis of chronic kidney disease, to give yourself some grace and some time to learn about it, maybe in smaller chunks, and then process, and then go back to your clinician, your doctor with questions. Always great to have those questions. Let the provider know at the start of the visit so they can plan accordingly. We have great colleagues in pharmacy, nursing, social work, and dietitians that can help. Sometimes you require referrals to see these individuals, but they can and want to help. Make sure that you have an advocate with you if that is helpful to you, family or friends. And know that you're not alone. There's 1 in 7 individuals in the United States with chronic kidney disease. And joining us with Kidney Action Week is a great way to kick off having more knowledge and getting more proactive in your kidney health. Thank you.
And thank you, Dr. Julie. That was an awesome presentation. And I just want to say for our viewers, once again, this is Kidney Disease 101, everything you need to know about kidney disease. And so, Dr. Julie, this section, I wanted to get into a few scenarios, a few questions, if you would.
Sure.
Let's go back to when I was diagnosed with kidney disease, right? So there was some testing done, lab work done, I had to do. So now with kidney disease, based on my lab tests, what would happen next?
Sure. Great question. And thank you for drawing in kind of your personal experience as well. So as I said before, I think first it's important to give yourself space to learn about this. It's a complex condition. It's one term, chronic kidney disease, for a lot of different things that can happen to the kidneys. And asking your provider for vetted resources. And what do I mean by that? For example, the American Kidney Fund educational materials, vetted online resources, because I feel like, as having been a patient myself and other chronic conditions, we can go down a rabbit hole, so to speak, with our minds and what we're thinking about. And
Absolutely.
Finding good resources, I think, is a great start. So educating yourself, and then writing down questions when you're looking through materials, because again, things are very complicated related to the kidneys. Then I think the important thing is to plan next steps with your provider, your doctor, clinician that you're seeing. That may involve additional blood tests, urine tests, sometimes even kidney tissue. And that's where you might be getting a kidney specialist involved. And I think the key thing is just to remember, Craig, that it's an ongoing process, right? And that you cannot possibly learn about everything there is to learn about your kidneys or kidney health. And especially when you're facing this as a chronic condition. So just remembering that and kind of taking time along the way to recognize that it's going to be a process, kind of more of a marathon, not a sprint.
Right. Awesome. That you're absolutely right about that. And you mentioned something in your answer when you was explaining it, and it was a great segue into my next question for you is that I know I had to see a kidney specialist, a nephrologist like yourself. And also I was back and forth between my primary care, my PCP. Could you explain the difference between the two, their different roles, and why they're so important as it relates to kidney disease?
Absolutely. Thanks. And that's a great question. And again, I think for any patients, and especially those who have a kidney condition or chronic kidney disease, it can be overwhelming because all of a sudden you used to see maybe one primary doctor, right? Just as you said.
Right.
And those primary doctors, first and foremost, they can manage a lot of the aspects of chronic kidney disease, especially those that are due to common causes like high blood pressure, diabetes. But people might see or be referred to, and it requires a referral to a kidney doctor if there is, for example, signs of inflammation from their kidney disease. So what would that look like? Potentially blood in the urine on urine tests. A lot of that albumin that I talked about, something that's not within the typical ranges that a primary care provider might see, it might be many times more. And in that
Mhm.
case, you may see a kidney doctor. And certainly when that filtration is lower, and there are some
Mm.
guidelines that recommend that a patient sees a kidney doctor or be referred to a kidney doctor when their EGFR hits a certain target, maybe less than 30%, or sometimes in some cases less than 45, or when protein is very heavy. So there are some guidelines to assist providers and patients in that. But again, negotiating as a patient, I understand is not an easy thing, and it adds more visits on. So, what I'd say is that first and foremost, in early stages and within the confines of different diagnoses that primary care providers will treat commonly, so diabetes and high blood pressure, then a person might just see that one primary care provider. But we'd add in a kidney specialist if there are complications or they're getting more advanced in their kidney disease, or if we're seeing things that aren't kind of the usual causes, as I'd shown earlier in my presentation. And then you'd be seeing a kidney doctor. I think it's important, and sometimes maybe not working the way we want it to work, Craig, as far as the communication between two. I'm just going to be honest.
Right.
And hopefully it's better maybe if you see them in the same system. I'm not advocating for that. I'm just saying that that's what my patients sometimes say. But I
Mhm.
think we still have a long way to go in increasing that dialogue between the two. So if as a patient, a person ever feels that way, gosh, I hear this one thing from this one doctor and another thing, I think
Right.
it is okay and very much within the realm of advocacy for yourself. And again, bring family or friends if you need to. I've had people do that in my clinic. I love it. I think it's great. But just advocacy to say, can you please share this information with my primary doctor with a letter at least, and maybe some dialogue if things get more complex.
Yeah, I agree. And also, too, we have some great tools out there, such as My Chart, and we can communicate that way. And so I'm going to jump around here just a little
Sure.
bit. What are the benefits of learning about disease early on? What are the
Right.
benefits?
Yeah. So I'm going to fully be transparent that my research is in trying to help people know about their kidney disease early. So I'm kind of on that side of the fence. So here's why I dedicated my research career to focusing on that. Because one of the benefits is that as a patient, if you think about finding out that you have something when you're in more severe stages, a person might ask, as they did me as a kidney doctor, well, what happened the previous early stages? And why didn't I hear about this to
Mm,
maybe align my behaviors? Or maybe it's not anything I'm doing, but just align my care with the things I need to do to prevent progression to later stages. And I think that's a great point. And I think it's also the reason why I advocate for people learning early. And I have to tell you, throughout my research part of my career, Craig, I've kind of gotten into more educating the general public because it starts as a patient, but I don't
mhm.
feel in the general public that we have enough kind of science, early science information for youth, even about
Right.
understanding the kidneys and their functions and what they do. And generally, people will know about the heart, or the brain, hopefully, through their curricula. But so some of my research, I'm even bringing further forward into youth programs to try to get that a little bit earlier, not overwhelming, but a little bit earlier with youth in the schools.
Eh, I see why you're here with us today because you're doing a great job just segueing um, into the next question because this is a perfect question when you talk about uh, educating the general public. So this my next question is how often should someone get their kidney functions test? Because in your presentation, you mentioned about the two tests. Talk about that just for a second.
Sure, I will. And I think, again, great question. So, um, one of the slides, and probably the one that was a little bit more colorful but yet confusing, again, came from the Kidney Disease Improving Global Outcomes Organization, and an international organization that helps us with guidelines about chronic kidney disease. And they provided kind of a table, which was a little bit of an algorithm or a step by step for clinicians to provide recommendations It's not cookie cutter. It's not one size fits all. We're individuals as humans, so we're individuals as patients. But generally, based on people's filtration rate and the
Mm.
amount of albumin that they have in the urine, there are suggestions that say it can go from everywhere from, hey, check once a year or screen once a year if you have risk factors for kidney disease, like diabetes and high blood pressure. Um, and then if you actually have chronic kidney disease and albumin in the urine or the reduced EGFR, then you'll see that those frequencies go from a couple times a year to 3 to 4 times a year. And I'll just add a caveat that in my clinic, I have some patients that are very near needing a kidney transplant.
Mm.
Some of the individuals aren't able to get one right now, so they'll be using dialysis as a bridge to transplant. And with those patients, I might, my goal is to safely delay initiation of dialysis as long as we can, because once they start, they're on it until they get their transplant, right? And it's a new beginning, but it is a different way of integrating care into their lives. And so I'll check their labs weekly to every 2 weeks.
Mm.
Um, Checking with them on portal messaging or through phone calls, and just making sure that they understand the flags for which to escalate their care if they're going to the ER. But I try to get people as prepared as possible, kind of like an insurance policy. Gosh, we hope we don't need to use it, but we may. And then even we'll go into that frequency.
Okay. Okay. Great, great, great. One other question, because and everything is actually flowing great, perfectly, because so many individuals don't learn of their kidney disease until it's too late. In the industry, we call it crashing into dialysis or that stage 5 end stage renal failure. Also, too, others may learn about it early, and hopefully that they are by getting tested early, right? We want to advocate for that. Go get tested. And so, what what are some different ways or paths, so to speak, people with kidney disease might experience at this point?
Yes, there are different paths. I'd say that there's some that are more ideal paths and some that maybe aren't as ideal from the patient experience and from what we've learned through research with patients. Maybe not unlike other chronic conditions. But speaking to chronic kidney disease, I'd say the ideal path is one where you're engaged with a primary care clinician, doctor,
Mhm.
um, and that they're aware of your risk factors for chronic kidney disease, that they're testing with the algorithm I kind of talked about, but at least once a year with an EGFR and a urine albumin to creatinine test, especially in diabetes, hypertension, and there are other things that people will learn during Kidney Action Week as well. And so when an individual provider sees that a person might be having any of the flags that I talked about earlier,
Mhm.
so kind of a decreasing EGFR more quickly than expected, really high albumin in the urine, or blood in the urine that can indicate inflammation, or other things that they're curious about, then at that point, the ideal would be then they're bringing in a specialist, a kidney doctor to help them, and maybe other specialists too, maybe heart doctors or rheumatologists, but that would be more of the ideal. And if things don't go the way we want, if despite optimizing all of the therapy for the patient and the patient working really hard on, all of these things they're being asked to do, sometimes
Right.
things still don't go the way we want them to. It is not the fault of the patient not doing things well enough or the provider. Sometimes that's just what can happen with the body. And so in that case, the kidney doctor should be, and certainly would want to be, preparing that person to learn about options for renal replacement
Mm.
while they're trying to slow progression of their kidney disease, and then having them not start it emergently, but something in a way that's very planned. And the crashing that you mentioned is very interesting because that is a term that we use. And I feel like it's something that patients, in fact, feel. And it would be the patients who maybe don't have that ideal situation. Maybe they're just feeling healthy because there's not a lot of symptoms of kidney disease
Mm.
until it gets advanced. Maybe they
Right.
had no other conditions And maybe they don't have the checks that had been recommended, or even maybe they do. And it's just something that progressed very rapidly. And so when we talk about crashing, the other way that people can present would be a pathway where suddenly they don't feel so good. And they're going into the ER and find out, golly, my labs aren't looking that great. My urine tests aren't looking that great. Gosh, I'm at the point where my kidneys actually are in failure and I might need some renal replacement, which is, again, transplant or dialysis. And transplants often take a while before people get them.
Yes.
So that would be a example of when people are starting very rapidly on dialysis. So those would be the different paths or scenarios. And again, what we're trying to do to advocate here is for people learning about the kidneys during Kidney Action Week, and then using that information to inform their decisions and share decision making with providers, and also their next steps to be proactive in kidney health.
Awesome. Wow. What a great way to kick off Kidney Action Week. We are laying a strong foundation here in this very first session with Dr. Julie. 30 seconds, Dr. Julie. Out of everything you presented in this first session, what is one thing that you hope our viewers out there would get from it?
Super. Okay, I'm going to cheat and I'm going to do two things, but I promise I'll keep it in 30 seconds, okay? And obviously in the context, it's very hard. And I know you're laughing with me here. But so I'd say that first and foremost, what they're doing by joining Kidney Action Week to me is a great start, because to me, it's part of advocating for yourself, for your kidney health, and the next steps in your kidney care. So number one is being an advocate, and please feel empowered. And I know it's hard because I've been a patient myself. I'm in the medical profession. And it's been hard for me sometimes to advocate for myself when we're talking about management plans about me. So it has nothing to do with how smart people are or how much they know about medicine, although it feels that way. And it feels that way to me too. So what I'm saying is in this 15 minutes or 15 seconds, I'm sorry, I'd say that please just know that you can advocate for yourself. And then in the next 15 seconds, the other takeaway is that I want people to know that a diagnosis of chronic kidney disease is not the end of anything. It might be a new beginning, but in every stage of management of diagnosis and management, there is hope for good things and positive next steps. So that would be the other key takeaway.
Wow, that's awesome. Thank you so much, Dr. Julie.
You're welcome.
Folks, I hope you got it all. I know I did. I would like to now call you the legend of the GOAT, Dr. Julie. Thank you so much for joining us today. And as we wrap up, I want you all, the viewers, to stay tuned. Keep it right here on the AKF Network. We have another session, another great session coming up. It's genetic testing and CKD, a Q&A with genetic counselors. This session will begin at 11:45, so keep it locked right here. Keep it locked. During this session, you'll hear from two genetic counselors about the importance of genetic testing and how it can help you understand the cause of your kidney disease. That's a good one. They'll be answering questions from the audience, so make sure you get your questions ready. Write them down. Also, too, as we wrap up this session, and again, thank you guys for joining us at Kidney Disease 101, everything you need to know about kidney disease. You will see a brief survey pop up. Yes, you'll receive a brief survey. Please take a minute to fill it out and tell us how we did today. I know Dr. Julie, she gave 5 stars for me. She did an awesome job today, laying that strong foundation of the basics of kidney disease. And so make sure you guys fill that out and plan to be with us in future sessions. So this is Craig Merritt, Coach Craig here at AKF, also host of the Kidney Corner podcast. And we want you guys to stay locked in, stay tuned in. It's Kidney Action Week, folks. We're having a great time here. So thank you all for joining us today. And this is AKF, where we are fighting kidney disease on all fronts. We see you guys soon. Take care.